All right. So for our February Lunch and Learn, we have Dr. Mancini coming to join us. So Dr. Mancini, I'll throw it over to you if you want to do just a quick intro, a little bit of background on you before you dive into your presentation here.
Yep, perfect. And so we have, just to confirm, we have till, is that 1 o'clock?
Correct. Yep.
Okay, perfect. All right. And so I don't see how many folks we have on the call.
There's just a few on the call. We have 5 people on the call right now.
Okay,
we might
perfect.
have a few more jumping.
Okay, perfect. So just a little bit of background on myself. I'm a doctor of oriental medicine. I have a clinic here in San Diego, Mission Valley. We have 4 doctors of acupuncture, and primarily the primary focus in what we do is, we treat primarily, and say 90% of what we do is we treat work injuries. We also treat auto accidents as well, patients who've been injured in auto accidents. But one of the key elements that I emphasize with my doctors is that every single person that walks into this clinic, although they have pain, they're a human being. In other words, there are so many factors that are involved in their presentation beyond just the pain. And the more we can expand our view of the patient and not just focus on the pain, we see much better sustainable results that are more fulfilling to the patient than just treating their elbow, knee, shoulder, neck, back, and shoulder, and all those other factors. We're starting to look at them as a human being. My background really plays a big role in that, because early on, back 25 years ago, I began to compete and fight in full contact fighting. And what I realized was that I was learning how to really immerse myself in what we call this fight, flight, and freeze response. Can everyone hear me okay? Can you hear me, Starla? Okay. Mm-hmm. And what it became for me in my years in fighting in the ring was kind of a laboratory experiment for myself to really have a sense of understanding how I manage, maneuver, and how I can work through these states that are what are basically ancient and primitive states, and everyone experiences them. So it's been my passion for the past 25 years to continue to understand these primitive systems and how to work through them into what we call a flow state. Now, what's interesting is that when I was training and fighting in the ring, I would experience these states that every single person feels, but most people don't realize that their nervous system is responding to their daily activities of life, those demands, those stressors, no different than a real threat. The only reason why they wouldn't know that is they weren't in front of an opponent that wants to, attack them or take them down. So most people don't realize that the nervous system is responding the same. And the big challenge here is that when we get into these survival states of fight, flight, and freeze, which we're going to talk about today, the repair system of the body, the restorative system of the body's ability to regenerate declines exponentially. It slows down and it's reduced primarily because the body needs to be very efficient with its resources into managing this real or perceived threat. And in today's world, if you don't truly have a real threat, it doesn't matter. Your body's still going to respond the same. So our focus here at the center with my doctors is really get beyond the story of the patient, because every patient comes in with a story about their injury. They come in with a story about why they're so stressed out. And number one, we're not psychologists. And number two, it's not going to serve the patient if we just get pulled into the rabbit hole of their story. So what I focus on, and my hope is today for all the clinicians that are on the call, and actually every single person on the call, is to start to notice your own personal states. In other words, become a state tracker. Get beyond the story about the content of why you think you're angry, frustrated, overwhelmed, upset, feeling hopeless, and notice that below that emotional experience, there is a primitive state that's amplifying it. And the more you can become aware of that state, the more you can maneuver and regulate it and move through it into what I call a flow state. And a flow state is a state when we feel like we're on our game. A flow state is when we feel like we're unstoppable. A flow state is when you feel like you're so aligned that you pretty much can do almost anything. I mean, have you ever felt that, Hope? Have you felt that before?
Oh, yeah.
Okay. Hope is over here on the right side of me, so I'm going to be chatting with her to get some feedback. Starla, have you felt that before, where you felt like you just on your game, like everything is going well?
Yeah, for sure.
Yeah, and everyone has in the world of athletics. We call it being in the zone, and every single person has experienced it. But what happens is it becomes a fleeting experience. It comes and then it goes. And what I want to do is I want to have everyone have a sense of what is it that brings you into that place so you can access it more consistently, just like an athlete getting ready to step into the ring or in the platform. And in fact, I want every single person on this call to realize that my platform was the ring, but you can take out the ring and you can put in whatever challenge you have in your life, whatever demands you have in your life, whatever tends to test you or push you, or when you think about that thing, you get a little bit of that uneasy feeling, right? And this is a great opportunity to start really understanding what triggers it and how do you take that energy and transform it into what I call a flow state. So that's going to be our practice today. That's going to be our focus today. It's my hope that everyone walks away with some sense of this, this ancient system. So the most important thing to really get here is that the autonomic nervous system has a language. And the more you understand a language, no matter what language it is, if it's Italian, Chinese, Spanish, whatever the language is, the more you can relate with that person. And in this case, the more you can understand your own internal dynamics of what drives you to do what you do. Once you start to understand the language, you can start to befriend your own autonomic nervous system. It's like having a good friend. Once you start to have the ability to connect with your friend, you can start to respond to the needs of your friend. In this case, you're going to respond to the needs of your own nervous system. And once you start being able to understand the language, you can start to influence it. And that's going to be the real big goal here, is how do you take those feelings of uneasiness, anger, frustration, overwhelm, and take it into a higher level of energy? Now, what's really interesting is that every person that goes into a pain cycle, they immediately get activated. Whenever you're in pain, you are going to activate this system called the fight-flight response. And when that happens, you're not going to be as effective in anything you do, including your ability to repair your own body. And what's important to understand here is that when a patient comes into your clinic or center, the patient gets fixated on their pain. We all do, right? Whenever you have pain, you collapse into the pain condition. And one of the things about chronic pain to understand is that the longer the pain occurs, the less it has to do with the actual location of the problem, and the more it has to do with factors that are outside of the actual tissue trauma. So what we're seeing here, and I'm kind of transitioning here because I want to kind of give you kind of a 30,000 foot view before we drop into the practice. Anytime you have pain, anytime you get stress, your body is not efficient. And the reason why I say that is because when you go into those states, your frontal lobe, which is the crowning achievement of the human being, your ability to think, your ability to plan, your ability to see the bigger picture, all your executive functions starts to turn down, and the body goes into preservation mode, which means you're going to do what you need to do in the moment. And anything beyond the moment is not going to serve you. So when you're in a fight or flight response and you're stressed and you see that cookie, you're not going to think about your diet tomorrow. You're not going to think about anything. You're just going to eat the cookie, right? Because your nervous system's needing something to release it in the moment. So as we begin to what I call map, which we're going to do today, you're going to start to create some space from this system that most people get so absorbed in, they lose themselves. And especially when it comes to patients. So when a patient's in pain, they're going to get fixated on the pain. And one of the things I start communicating to patients and to my doctors and to my staff is when you have a diagnosis, you have to be really careful in collapsing all your resources into that diagnosis, because then you have no control. You become a victim. Now, it's important to have a diagnosis because in order to have a treatment strategy, we need to have a diagnosis. But when we think that the diagnosis is the end all be all, then we lose control. We have no control. We actually go more into what I call a freeze response. You feel disconnected because you have no ability to change the diagnosis as a patient. And a lot of times as anybody, whenever you have a pain condition. So one of the first things that I do, and I want to show you this interesting study just to give you perspective. And I tell patients this. You guys can see the screen there. Clinical study here.
Yep.
Okay. 2011 study was done by the renowned Cleveland Clinic, then published in the New England Journal of Medicine. The study included over 200 asymptomatic, no symptoms, test subjects who had never had back pain. An MRI was performed on the spine of each test subject. In the summary, 70% of these asymptomatic test subject MRIs showed disc abnormalities. 52% had bulging discs, 29% had at least one herniated disc, and 65% had degenerative disc disease. Now, when we see that, immediately we realize that, you know what, as we get older, we're going to have these things. So when a patient comes in and says, look, this is where my problem is, and you can see a sense of disconnect, like there's nothing they can do. And I share with them, you know, as we get older, we're going to have MRIs that are not going to look pretty if you have symptoms or no symptoms. So I want you to go beyond just your MRI, and I want you to start to think about what are things you can do for your own health. And what are the big amplifying factors? And I have this in as my next slide here. There's lots of different factors that trigger the pain or amplify the pain. And a lot of people just don't realize that. And a couple of them are just simple things like sugar. When someone has a diet that's high in sugar, they're going to create an inflammatory complex in their system. They're going to trigger more inflammation. Their nervous system is going to be more sensitized. If people are eating a diet that's a very inflammatory diet, they're not understanding that they are actually increasing and amplifying the pain condition. So yeah, they have low back pain, but they're getting the dial knob and they're turning it up because their diet is amplifying it. And if you don't create awareness for the patient, they get fixated on the diagnosis. Now, MRIs are important, but if we don't look at all the other factors that amplify pain, then the patient becomes a victim. And if a patient is feeling victimized, they have no control and they're not going to be able to heal as quick. And every single person that's in the area of therapy knows that if a patient doesn't take on the responsibility, they're never truly going to get better. They're always going to be having issues, right? Does that make sense? Mm-hmm. Now, of all these pain generators, one of the biggest generators of not only pain but also stress is this guy here in the bottom corner, the nervous system. And this is really where I want to put all our attention on, because this here, the autonomic nervous system, is really going to be the driver of all our experiences in life. Everything from your ability to handle whatever shows up in your life is determined on your nervous system. So I'm going to do a quick review for some people, especially if they're clinicians, and it'll be brand new for people that are not clinical, but I want to touch on this system. So the autonomic nervous system has really two big functions. One is an internal function of managing the body. That means every single function of the body is regulated by the autonomic nervous system. Everything from digestion to breath work, breathing, to elimination, to your heartbeat, all these are regulated by the autonomic nervous system. But when we go from the inside and we go to the outside, and then we start talking about this concept of the fight, flight, and freeze response. Have you heard of that response, Starla?
Mhm.
Yeah, Hope, you've heard of it? Okay. Now, this is a system that is set up to sense cues of danger and cues of safety. It's a system that's below the level of awareness. Some people call it a gut feeling. Some people just say, I have a sense, or this doesn't feel right. You can walk into a place or a room and you have a sense of, does this feel safe, or is there a sense of danger in the room? These are all primitive responses. What our practice here today is to start creating that level of below the radar awareness and bring it into awareness, so you can start to really get a sense of when your body starts to go down the direction of the fight flight response and how to navigate through it and how to move outside of it. Okay. So when we talk about the fight flight response, what we're talking about here is the sympathetic system. Think of it like your gas. Think of it as just an energy system. There's nothing wrong with the system. It's not a bad system. In fact, we need the system to engage with the world, from waking up in the morning to motivating yourself. The other side of the system is called the parasympathetic. And this system is more of the regulator and brakes. This part of the system is managing all your daily functions. So these are the balancing act all day long throughout your day. Now, when you get triggered, when you feel something like uneasiness or anger or frustration, and your body starts to get activated, you are turning on that sympathetic system right here. Now, when your body feels a sense of overload, where it's too much, where you can't handle it anymore, the body has what's called a dorsal freeze response. It's kind of like your circuit breaker. It's like you're putting in too much energy in the system, and you circuit break and you shut down the system. Now, this is a very important system to have because it's protecting your body from excessive amount of overflow in the body. So it wants to shut it down to go into preservation mode. But here's the challenge here. When you go into these states, there's always going to be a narrative that gets produced. So when you're in a freeze response, you're going to feel things like hopelessness, helplessness. You're going to feel disconnected. You're going to feel numb. You're going to feel like you want to hide. You're going to feel like nothing is working. You're going to back up from the world. And if you do that and you get stuck there, you're not going to function in the world. So it's understanding that your body has a need, address the need, and then you come out of that need. So it's about understanding how to regulate yourself through that process and not get stuck in it. Okay, does that make sense? So one of the first things that I want to teach everyone is a breath exercise that will help you be a better regulator, not only for yourself, but every single person that you come in contact with. Because here's a key thing. The more regulated you are as a human being, the more you can regulate others. You become what I call a co-regulator. And every single human being, because we're all mammals, we're all wired to connect. We have this need to connect. The principle, the condition failure to thrive in infants, where if they don't have that connection with their mother, their health declines. It doesn't stop at the infant. It happens all the way through a human's life experience. So in order to be that co-regulator, not only for our patients, but for our family, our friends, and for your team, for your coworkers, you have to make sure that you're regulating yourself first. If you're in a state of heightened arousal, anybody around you is going to sense it. Have you ever experienced a Starla, where you're feeling like somebody's really anxious around you and you just don't feel good around this person, right? It almost gets you a little bit revved up, right? It's because you can feel that. So one of the things you want to start doing is this technique we're going to touch on now is regulating yourself. And what will happen is as you regulate yourself, the person close to you will start to self-regulate. All right. And we're starting to see the research here that this experience goes beyond the boundaries of the body because they have the ability to measure these things, that these experiences will go to the people around you. So the practice here is to regulate yourself first, and then you can co-regulate someone else. So with that said, I want to teach everyone a breathing technique. Now, how I learned this breathing technique, it was about, I'm going to say about 23, 24 years ago when I began to fight in the ring. And I didn't understand the science then. I just needed to understand how was it going to help me when I was stepping against an opponent that turned on the survival response. So I was taught that when you are engaging with anything that's threatening, and in this case, an opponent, when you practice the specific breath cycle, you begin to allow your nervous system to discharge extra anxiety and tension. So when I was in the corner against my opponent, my body would turn on because my brain's going, that guy across the other side wants to hurt me. And the moment my nervous system perceived that, my body started to activate. Normal response, there's nothing wrong with that. But if you don't regulate it, it'll cause you to go into a freeze. And in the ring, freeze is not good. Actually, in life, in the world, freeze is not good, right? You stop, you can't interact. So in doing this breath work, what it did, it started to help me regulate my own nervous system. And as part of that, I would shake my body. Now, why would I shake my body? Because when I'm moving my body, I'm releasing extra energy that is causing that can cause my body to overload. So the more still you are when you're in this heightened state, the more probability you're going to go into a freeze mode. So one of the first regulators for when you're under a stress response is to move your body. Step one. So moving your body, either shaking it or bouncing or going for a walk. And that's one way to regulate when you're feeling anxious, overwhelmed, stressed, angry, all the fight responses. That's one way to do it. The second way is through the power of breath. So with that said, let me give you an understanding before I teach you the actual technique. And what you understand is that your heart rate is always speeding up and slowing down. So when you check your pulse, we check the average over a minute's time. But if you checked pulse to pulse within that minute, you're going to notice that the pulses are going to be at different rates. The difference in the rate of your pulse from pulse to pulse is your heart rate variability. That means the more variable your pulse rate is, the healthier your nervous system is. So if you look here on, can you guys see my mouse there? If you look here, here's one beat, second beat, third, fourth. If you notice the timing between each one, it changes. So as your pulse rate changes, it's an indicator of how well your nervous system is functioning, the flexibility of your nervous system, specifically that sympathetic fight flight and that parasympathetic rest digest. So the heart rate and pulse reflects the interaction between the sympathetics and the parasympathetics. This is your autonomic nervous system. The sympathetic branch drives the increase in your heart rate. So as you inhale, you activate the sympathetic system. And as you exhale, you engage the parasympathetic system. So your breath is the push button to engage this fight, flight, and freeze response and how to move through it. And breathing is the most direct route to do this process. So with that said, let's go into the actual technique. So when you inhale, I want everyone on the call, if you can take a nice deep inhale, you're disengaging the brakes and you're activating the sympathetic system. Now, as you're exhaling, you're engaging what we call the vagal brake. And as you're engaging the vagal brake, your heart rate slows down. So I want everyone on the call, if you can place your hand on your carotid where you feel your pulse, or on your wrist. And I want everyone just to take a moment and take a deep breath in and notice if you can feel your heart rate increase. And as you exhale, notice if you can sense your heart rate slow down. Now, the exhale, really important, is you want to slow down the exhale as slow as possible. And just do a couple breaths, nice deep inhale. And as you exhale, as slow as you can. The key element here is that the longer the exhale, the more regulation you have on the nervous system, on that sympathetic fight or flight response. And I can tell you firsthand that when I was dealing with the actual threat of an opponent and I did my breath on the exhale, my whole body began to calm down. It began to regulate, it began to center itself so that my frontal lobe, and this is important for everyone, the more calm down your nervous system is, the more your frontal lobe is open. When your frontal lobe is open, you can see the bigger picture. You can see down the road. You have the ability to think. Everyone, does that make sense? Okay. Now, I have some images here to really solidify an understanding of this vagal brake. So imagine you're going on a bike and you're going downhill full speed. The way you regulate it is by tapping on the brakes, right? Now, you don't want to be squeezing the brakes all at once. You're going to be tapping on them to regulate your speed and your ability to control yourself. That is the same or similar concept to the vagal brake. You can think of it like a water spout. You have a lot of water coming out of a hose. You're regulating the amount of water going out. If we took off the vagal brake, if we eliminated or removed the vagus nerve, your heart rate would speed up. It would speed up 90 to 120 beats, even higher, because there's no governor on the heart rate. So that means that your sympathetic system, your fight-flight system, would get activated and you'd be in anxiety at all times. Your heart rate would be up. And we probably know people like that, right? So what this process does is it puts a governor on the system so that you can start to downshift it. And when you downshift it, I want to emphasize this, not only does your frontal lobe get activated and turned on, but you begin to shift blood flow back into the core of the body where all the organs are. Because when you're in a fight-flight response, what happens? The pipes get shut down in the core, digestion goes down, immune system gets suppressed, and blood flow goes into the arms and legs to fight or flight. Now, the more you do this practice, the more you're going to start to see that connection. This is an experience that you want to practice. It's not something you do once. It's not something that you do only when you need it. Because if you just do it when you need it and you don't practice this, it's like me stepping in the ring for the first time, never practicing and hoping that something will happen. You have to integrate this simple practice into specific times and locations in your day. So what I tell my patients is that you can set it up in a place where you normally will go to, for example, before you go to bed, when you wake up. Can you do 5 minutes of slow breath work and slowing down your exhale? Can you do it in your car before you turn the ignition on? Can you do it before you go into work? And we're literally talking about 2 to 3 minutes. And everyone has, Hope, you have 2 to 3 minutes?
Yes.
Okay, multiple times a day.
Oh, yeah.
Okay, Starla, do you have 2 to 3 minutes multiple times a day? Okay, perfect.
I do.
So what this is doing is training you not only for when the time comes that you need it, but what it does is it keeps interrupting these patterns that tend to build up in our day, but they're so unconscious because we tend to just get absorbed in them and get pulled by them. Next thing you know, you're down the rabbit hole, angry, frustrated, overwhelmed. And this doesn't mean you won't feel these, but you just won't get stuck in them. You're still going to have all these experiences, but you're going to be a little removed from them so that you don't keep living the same experience over and over and over. Okay. Does that make sense? Perfect. Now, is there any questions on this portion that anyone has, Starlight? Do we want to go through the process and then have questions and answers at the end?
Yeah, we can do questions at the end. Not a
Okay.
question, but a comment, I guess. It's funny, I've done this before, right? It's usually a part of like meditations and things like that, like the slow exhale. But I never really considered that that's activating the parasympathetic nervous system. It never clicked before right now. So very cool.
Yeah, no, and it's something that, in yoga, so I do yoga and we have the Ujjayi breath, we're exhaling slow. A lot of times when we have a better understanding of something and how it impacts the mechanisms of our body, it's going to give us much more reason and drive and motivation to do them, as opposed to just because somebody taught us it and I'm not really sure how it works. But this literally is you putting yourself in the control seat of what drives everything in your life. So it's a process that it's intellectual for most people right now on the call, but the more you practice it, you're going to do it, because you're going to need to do it in certain times that if you don't, you're going to go into that down spiral, that downward spiral. So thank you for the share on that. Okay. So that's probably one of the most powerful techniques. But what I want to do really quick is I want everyone to get a sense of the language of their own autonomic nervous system so they can start to map their own nervous systems. So I want everyone for a moment to think of a time that they felt the following. I have this uneasy feeling in my body and mind, and I can't relax. I'm getting overwhelmed. I'm having a hard time keeping up. I feel anxious and irritated. The world seems dangerous, chaotic, and unfriendly. So Starla, since you're the person I can see here on the call, have you had an experience like that in your life? Many times, right? That's going to be your sympathetic system. So what about this? I don't feel safe. I have no energy to engage with anyone. I want to be alone. I'm buried under a huge load and I can't get out. I'm alone and I'm in despair. The world is empty, dead, and dark. Have you ever felt that? Maybe not said it to anybody, but have you ever felt that?
I think from time to time we all do, right?
Absolutely. How about this? Everything feels safe and I'm relaxed. I want to connect with people. I'm feeling at ease. I can manage whatever comes by my way. I feel empowered and connected. I see the big picture and connect to the world and the people in it. We've had those experiences too. So one of the elements that everyone needs to just really kind of let, penetrate is this. Your autonomic nervous system state determines how you see yourself and how you see the world. This is how you show up in your life. So if you look here on the side here, when you have a life event, say a project, a goal, an outcome, a challenge, a crisis, or a tragedy, you can show up in three different ways. You can show up in a fight or flight response, but when you're in a fight or flight response, you're overwhelmed. You're not going to make the best moves. You're not going to make the best decisions. You're not going to think bigger picture. When you're in a freeze response, you're going to feel numb and disconnected. Any goal is going to be too much. So have you had an experience, Starler, where you had a goal, but one day or down the road, it just feels like it's too much, right? Mm-hmm. But then there's days you go, I got this, right? It's like, I got this. This is good. I can handle this. And the only difference, and I want to emphasize, the only difference is your state, because the goal hasn't changed. You set your goal up on the front end, but what changes throughout your day and your life is the state that you're in. So one of the elements that we need to do is we need to start to map our own states. So I have this handout, and by the way, I'm gonna give this presentation to you guys in a PDF fashion so you can actually use some of this information. But this is called a map. And what a map does is it helps us understand where we are and where we need to go. And the way I have this map set up is it's kind of like a ladder. And you see the fight flight response right in the middle. What I encourage everyone to do is at some point after this talk is to start to write down the characteristics and the qualities of when you're in that fight or flight response. And what are the qualities or the characteristics when you're in a freeze response? And what are the qualities of when you're in a flow state? Because what this starts to do, it starts to allow you to objectify when you're in those modes. And when you're in those modes and you're aware of it, you will be able to move through them more effectively just by becoming aware of what state you're in. So let me give you kind of a sense of what that would look like for me, so everyone can kind of get a feel for this. So when I'm going to start with the fight flight, when I'm in a fight flight state, I feel like I'm running out of time. There's not enough time, or I'm out of time. I have more to do. I feel tense. I feel rushed. I feel confused. Can anyone relate? I have racing thoughts, easily distracted, overwhelmed, feeling increased tension. You guys can get the feel for this, right? Now, when I'm in a freeze response, this is what it looks like. I feel like everything is too much. Things are closing in around me, especially the world itself. I feel like I'm not good enough. I'm more unworthy. There's a feeling of heaviness and numbing over my head and shoulders. I feel like I want to check out and disassociate. I feel numb and fuzzy headed. I feel disconnected. When I'm in a flow state, what does it feel like? I feel like I have a feeling of absolute love and connection and a bubbling energy. I feel playful. I want to savor people and moments. I have this deep, peaceful feeling. I feel such gratitude and appreciation in my life for things, and where I can go to the point of tears. I mean, I feel that incredible. Now, every single person has a storyline. And the important thing here is to start to write down the storyline in each of these three states, so that when you're in that state, you can then become aware of, I'm in flow state. I'm going to stay here. I want to understand the quality so I can keep coming back to this. Or if I'm really far from it, I know how to get there. When I'm in a fight flight response, I know I'm in a fight flight response. So I'm not going to make the big decisions. I'm going to maybe preface that I'm not in the best place right now around people that I care about most, because I'm not going to probably say the best things, right? When you're in a stress response, you're not too loving, right? When you're in a free state, you're probably not going to want to make the big decisions. When you're in a free state and you're feeling these feelings of disconnect, you're probably going to want to pause. You're probably going to want to suspend that decision for a day, or as you get better at this, for an hour. Now, what's important to know is that in each of these three states, you have a specific view of the world and a specific view of yourself, your self-image. You have three different images based on which state you're in. So when you're in a fight-flight response, the world is, for me, this is my personal map. The world is overwhelming and confusing, and I am scared and scattered. When I'm in a freeze state, the world is dark and far away, and I am small, unknown, and alone. When I'm in a flow state, the world is a playground, fun, and safe, and I am peaceful, poised, powerful, and inspired. So what we're doing here is we're starting to basically unpack the qualities of each of these states, so that when you're in them, you can navigate, move through them more effectively and more efficiently. And we're all going through them all day long, every day. We just don't want to get stuck there. So what I have here for everyone is just a set of questions that will guide you as you want to fill in the map of your nervous system. And just to give you a sense of it, is when you're in it, you can't ask these questions. When you're angry and when you're trying to get into these states, you can't do it because you're not thinking, your frontal lobe is turned off. But as you do the practice, you're going to start to be able to sense it as you're moving into the state. And often in the beginning phases, when you're in the state already and you realize you're in it and you wake up. And the moment you wake up in that state, you say, okay, right now I'm in a flight fight response. What do I need to do to move myself through it? You know what? Right now, I just need to be quiet. I feel like I want to disconnect from the world, and I'm going to listen to it, but I'm not going to go get caught up in the narrative that gets played out in that freeze response, where I want to just give up. Okay, my freeze response is I want to give up, sell my practice, and run away. That's not going to work. So when I'm in my freeze response and I feel disconnected, I just get really quiet and I stay with my breath. And I just move my body. I'm just making sure I'm moving my body. So I'm either moving my body or I'm watching my breath, but I'm allowing my body to process through it. But I'm really being aware of not to get pulled in by the stories that get discharged in that state. When I'm in a fight flight response, I have a different narrative. I have a different storyline, right? Because when you're angry, you're going to have different thoughts than when you're feeling hopeless. But when you're feeling good, you're going to have different thoughts. So what I want everyone on the call here to do as we're wrapping up this call is, number one, start to map your states. Sit down, go through the questions, and really get a sense of what you're like in each of these three states. And throughout your day, if things come up, because you're not going to be able to grab it all at once, but things will come up and you're going to go, you know what, this is the quality. I tend to rut, like my mind starts to spin really fast. And when my mind starts to spin fast, I start feeling a little uneasy. Let me go to my breath, but let me write that down. My mind gets really racy and my body feels heightened. Let me write those down. So what I'm going to start noticing is that as I'm starting to go into racing thoughts, it becomes a reflection for me to know that I'm driving down the wrong road and I need to regulate my body. And how do I do that? You know what? I'm going to go for a walk right now. I'm feeling overwhelmed right now. I need to go for a walk. I'm going to do some breath work. So with patients, the best thing to do is when you're doing the therapy and you're doing physical therapy, you're moving the body, you're engaging that sympathetic system, you're activating it. But between each of the exercises, what if you can maybe teach your patients this breath work where they can start to regulate in between sets. As they begin to regulate in between sets, they're going to start learning how to regulate their own autonomic nervous system, which will optimize their own health, growth, restoration, repair, and rehabilitation. They're going to start feeling so good that they're going to want to start doing it outside of the therapy. And when they start doing things that fulfill themselves outside of the therapy, they're going to go, where did I learn that? I learned that from my therapist, my physical therapist, right? Or I learned it from my acupuncturist. So they start making the connection to go, you know what? I'm getting so much more than just the needles or the therapy. I'm experiencing more fulfillment because this exercise that I was taught is really helping me handle stress, right? So, but remember, most importantly, we have to be regulated first before we can help other people be regulated. Okay, so that's the most important thing. I think we're at the 1 o'clock hour here. Any questions? Anything I can answer for the group here?
Yeah, that was awesome. I know it's 1 o'clock, so a lot of you guys probably have 1 o'clock patients. So no worries if you need to jump off. But yeah, I think this has so many applications personally, and then while treating patients too. I mean, teaching it to patients, but also just, you know, the stress of the workday treating patients. It's a lot. So this is super helpful to use kind of throughout the day.
Absolutely. And you know, for the clinicians and for every single person on the call, you know, you can just set up times and locations to do a 30-second slow exhale. Like for me personally, I will, before I step into any patient's room, I get grounded. I slow, and it's you know, for me, it's 15 seconds. You'll get better and faster at it. You can regulate real quick. So when you're stepping into an experience, you want to be regulated. When you're working with patients, you want to be regulated. If you're not regulated and you're dysregulated, the patient's going to feel it. And when they feel it, they're not going to be as effective in their own personal regulation. So regulate first, and then everyone around you will learn how to regulate. You can teach this to other people, but you have to be the practitioner of it, most importantly.
Yeah, absolutely. Awesome. Well, are there any questions for those who are still on the call? Anyone have any questions for Dr. Mancini? All right. Well, thank you so much. And then, like he said earlier, I can send out these slides too for everyone to use as kind of a practical application. Maybe you can use with patients as well. So I'll send that out after today's call.
Perfect. And I just want to point out one thing real quick is you can help patients regulate with what I call top-down regulation by asking certain questions that will help them move into a flow state. It's just such a simple thing because your questions will direct people's focus. So when you ask a question, the brain's going to search for the answer. So you can help people regulate by directing their focus. So I just want to mention that because sometimes people get so absorbed into the pain, they're getting locked into it. So you can help them pull out of that pain and give a bigger picture by asking different questions. The moment you ask a question, boom, the focus goes somewhere else to get them out of a stress response. I'm saying that's a way to do that. And then one last thing, Hope already experienced it, what I call flow state. A lot of times people don't have a sense of what it feels like. So what I want to do is I want to give everyone an opportunity from your organization to come into our center and experience acupuncture. And what I do with the acupuncture is I help patients get into a flow state so they have a sense of what it feels like so they can recreate it in their everyday life. So for our patients, no matter what kind of injury they have, I'm teaching them these principles over a period of treatments. But for folks on the call here, I'd like to extend that invitation to come in, receive an acupuncture treatment so you can feel what it feels like to get into a flow state so you can recreate it on your own time too. So I want to extend that. Hope already knows that too.
Awesome. Yeah, we appreciate that. Do you want to just mention where you're located? We have people kind of all over California.
That's right. I forgot. So we're in Mission Valley, San Diego. We're right next to what was once Qualcomm Stadium, no longer. So we're right in the heart of Mission Valley, San Diego. Yeah.
Cool. Awesome. Well, thank you so much for your time today. We really appreciate it.
You're welcome. Thanks, Starla. Appreciate you guys.
All right, guys. Have a great day.
Take care. Take care.